Okay, let's get into this. Thinking back to high school science, it's funny what sticks with you. For me, it wasn't dissecting frogs, surprisingly. It was the stuff that sounded completely out there, like pure science fiction.
Oh, yeah. Like what?
Lasers healing things, pills making you super smart. Seemed impossible. And what's really wild is that some of that future stuff is what's just here now.
Right.
Like hyperbaric oxygen therapy. Sounded like something out of a spy movie back then.
It does have that ring to it, doesn't it? But yeah, it's very real, established medical treatment today.
So for anyone new to this, HBOT, hyperbaric oxygen therapy, what's the nutshell version?
Well, at its heart, it's pretty straightforward, actually. It means breathing pure, 100% oxygen.
Oh,
but
yeah.
You're doing it inside a special chamber where the air pressure is higher, significantly higher than the normal air pressure around it.
Higher pressure, pure oxygen.
Got it. Think of it like, like super saturating your body with oxygen, way more than you could ever get just breathing normally.
Right, because normal air is only, like 21% oxygen?
Exactly. The rest is mostly nitrogen, other trace gases, so this is a huge boost.
And you actually have a cool connection here, bringing this back to school, right?
I do. I actually just recently got to go back to my old high school, which was fantastic.
Oh, nice.
Yeah, I spoke to the senior learners there about this very topic, and honestly, their curiosity about the science, the mechanics of it all, it was really great to see.
That's awesome. It is a fascinating field.
Yeah, it truly is. And I was just happy to share, the basics of how it works.
Okay, so listeners, think of this as your own private session then. We're going to dive deep into HBOT today. We'll look at the physics, how it even works. Then what that extra oxygen actually does inside you. And crucially, the specific medical situations where it's a proven evidence-based tool.
And that's a really key point. We need to be clear. We're sticking to the science, the accepted uses.
Exactly. You might see stuff online about other uses, experimental things. We are not going there today. This is about the established facts.
Absolutely. Let's keep it grounded in the solid evidence. So where should we start? Maybe the physics.
Yeah, let's do it. Pressure and gas. Okay, try not to give me high school physics flashbacks.
No complex equations, I promise. It's actually based on some pretty simple gas laws you might dimly remember.
Vaguely.
The core idea is this. Increase the pressure on a gas, and you can dissolve more of that gas into a liquid. Simple as that.
Okay.
Think about a can of soda. It's fizzy because carbon dioxide gas is forced into the liquid under pressure.
Right. Above the top.
Pressure releases, gas comes out of solution, makes bubbles. Same principle.
Okay, soda analogy, I can handle that. So how does that apply to us? Our blood isn't fizzy, I hope.
No, definitely not. But our blood plasma, the liquid part, can dissolve oxygen. At normal air pressure, it holds a little bit.
Just a bit.
Right. But inside that hyperbaric chamber, we ramp up the pressure and give you 100% oxygen to breathe. That increased oxygen pressure basically forces much more oxygen to dissolve directly into the plasma.
So it's not just the red blood cells carrying it anymore.
Exactly. The hemoglobin in red blood cells gets saturated pretty quickly anyway. This pushes extra oxygen into the liquid plasma itself. It's like giving the plasma its own oxygen supply line.
Supercharging the blood liquid, okay. What kind of pressures are we talking? Is it like deep sea diving pressure?
Good question. Not usually that extreme. Typically, for most treatments, we're looking at maybe 2 to 3 times normal atmospheric pressure. We call that 2 to 3 ATA. Atmosphere is absolute.
Okay, 2 to 3 times normal.
For some really specific, urgent things like an air embolism or serious decompression sickness, the bends, you might go higher, maybe briefly up to 6 ATA.
Right.
But even that is way less than what, say, a deep-sea submersible experiences. It's significant, but medically controlled and safe.
That's reassuring. And this happens in special chambers.
Yep. 2 main kinds. You've got multi-place chambers, bigger rooms, basically. Several people can be treated at once. Medical staff can go inside, too.
Like group therapy, but with pressure.
Sort of. Then there are monoplace chambers. Those are just for one person. It looks a bit like a clear tube or pod you lie down in.
The solo mission pod.
Exactly. Either way, they're built tough, obviously, to handle the pressure. Patients usually breathe the 100% oxygen through a mask or a hood.
Makes sense.
And safety is just paramount. You've got high pressure, pure oxygen. That means a higher fire risk.
Oh, right. I didn't even think of that.
Yeah, it's a huge consideration. There are very strict rules, like the European Code of Good Practice for hyperbaric medicine. Certain materials are banned inside, special electrical equipment. Everything is designed to minimize that risk. No charging your phone in there.
Definitely noted. Okay, so physics check.
Yeah.
Higher pressure pushes more oxygen into the blood plasma. Now, the biology, what does all that extra O2 do?
This is where it gets really interesting. The most basic effect is getting more oxygen delivered to tissues, especially tissues that are struggling, that are hypoxic, meaning low oxygen. That high oxygen level in the plasma helps drive oxygen deeper into areas where blood flow might be poor, like pushing water into dry soil.
So if circulation is bad somewhere, this can kind of sneak oxygen in anyway.
That's a good way to put it. It helps overcome limitations in the normal oxygen delivery system. And
Nice.
this is absolutely massive for wound healing.
Okay, wound healing. How does oxygen help fix a cut or a scrape or something more serious?
Well, healing is actually a complex dance, happens in stages. First, stop the bleeding hemostasis. Then inflammation, the body's alarm system. Then proliferation, building new tissue. And finally, remodeling, strengthening it all up.
Right.
And oxygen is critical fuel for almost every step. Your immune cells, like neutrophils, macrophages, they need oxygen for what's called a respiratory burst.
Sounds dramatic.
It kind of is. They use oxygen to create reactive molecules, like little weapons, to kill bacteria and clean up debris.
Wow, okay.
Then you have fibroblasts, the cells that make collagen.
It's a skin scaffolding.
Exactly. They need lots of oxygen to build that structure. And then angiogenesis, building new blood vessels to the site, also needs oxygen.
So oxygen is like the essential worker on the healing job site.
Perfect analogy. Now think about chronic wounds, the ones that just won't heal, like some diabetic foot ulcers. Often the big problem is hypoxia, not enough oxygen getting there.
Makes sense.
HBOT can break that cycle. It floods the area with oxygen, which helps reduce swelling, boosts those immune cells, gets the fibroblasts working, and can even encourage stem cells to come to the area and help rebuild.
That's incredible. So that's why it helps with things like those ulcers or maybe skin grafts.
Precisely. Diabetic foot ulcers, tissues damaged by infection, skin grafts or flaps that are struggling to survive before they get their own blood supply established. HBOT provides that vital oxygen they're starved for. Studies clearly show it improves healing in these cases.
Amazing. Okay, so healing. What about fighting infections directly?
Yes, that's another key role. Oxygen itself can be toxic to certain kinds of bacteria, specifically anaerobic bacteria.
Anaerobic, meaning they don't like oxygen.
Exactly. They thrive in low oxygen environments. Think of bugs like Clostridium, the one that causes gas gangrene. Nasty stuff.
Ugh, yeah.
Flooding the tissues with high levels of oxygen, like in HBOT, creates an environment that's actually hostile to these bacteria. It can stop them from growing, stop them from producing the toxins that do so much damage.
It literally poisons them with the thing we need to live.
Kind of, yeah. Plus, some of these anaerobes lack the enzymes to protect themselves from oxygen's reactive byproducts, making them more vulnerable. It also helps our own immune cells kill them more effectively.
So it's a double whammy against those bugs.
It is. But it's really important to stress, especially with something like gas gangrene, HBOT doesn't replace surgery. You still need to surgically remove all the dead and infected tissue. HBOT is an adjunct, a powerful helper alongside surgery and antibiotics.
Got it. Surgery first, then HBOT helps clean up and heal. Okay, healing, infection control. What else? You mentioned bubbles earlier.
Yes, back to the physics. This is crucial for two specific conditions: arterial gas embolism, or AG, and decompression sickness, DCS, also known as the bends.
Depends, right, from diving too fast.
Right. In both conditions, you have gas bubbles where they shouldn't be in the blood or tissues. AGE can happen from lung injury due to pressure changes or sometimes medical procedures. Bubbles get into the arteries, block blood flow, very dangerous.
Yeah.
DCS happens when you decompress too quickly, like surfacing from a dive. Dissolved inert gases, mostly nitrogen, come out of solution too fast and form bubbles in tissues and blood.
Okay, so rogue bubbles causing chaos. How does the chamber help?
Simple physics, really. Boyle's law. Increase the pressure.
And the volume of the gas decreases.
Exactly. Putting someone in the hyperbaric chamber under increased pressure physically shrinks those gas bubbles.
Wow, that's direct.
It is. Shrinking the bubbles helps restore blood flow and reduces the damage. Plus, the high oxygen helps the tissues that were starved by the blockage. There are actually detailed treatment protocols, like the U.S. Navy treatment tables, that specify exactly how much pressure and for how long for DCS and AG. It's a life-saving application of physics.
Incredible. Using pressure itself as the medicine.
Yeah.
Okay, so we've covered the how and the what inside the body. Let's nail down the specific accepted medical uses, the ones backed by solid evidence.
Right. Let's list them out. We just covered two big ones: decompression sickness, DCS, and arterial gas embolism, AGE. The physics of bubble shrinking and the high oxygen make HBOT the standard of care here.
Okay, number 1 and 2. What's next?
Carbon monoxide poisoning. This is a really important one. CO, carbon monoxide, binds super tightly to hemoglobin, blocking oxygen transport.
The silent killer.
Indeed. HBOT works by using the high-pressure oxygen to basically knock the CO off the hemoglobin much, much faster than just breathing normal air. This restores the blood's ability to carry oxygen.
And that helps prevent long-term damage.
Yes, studies show it significantly reduces the risk of neurological problems after CO poisoning. And a key point for pregnant patients, they need longer treatment times to clear the CO from the baby system too.
Vital information. Okay, what else? You mentioned gas gangrene.
Yep, clostridial myonecrosis, gas gangrene, is a definite indication. As we said, the high oxygen inhibits the bacteria's growth and toxin production. Used alongside surgery and antibiotics, it's critical.
Makes sense.
Yeah.
What about physical trauma, like bad accidents?
Yes, several categories there. Crush injuries, compartment syndrome, that's dangerous swelling, cutting off blood flow in a limb, and other acute traumatic ischemias. Basically, any sudden, severe lack of blood flow due to trauma.
How does HBOT help in those messy situations?
It helps reduce the swelling, forces oxygen into those damaged, oxygen-starved tissues, and promotes healing. It can genuinely reduce tissue death, maybe even prevent an amputation. Often they'll start HBOT maybe at 2 ATA pretty quickly within the first day if possible.
Wow, could be limb-saving then.
Potentially, yes. Related to that are necrotizing soft tissue infections, those really aggressive flesh-eating infections. Again, surgery and antibiotics are primary, but HBOT supports by getting oxygen into the affected tissues to help control infection and aid healing.
Okay. What about problems that are more chronic long-term?
Chronic refractory osteomyelitis. That's a persistent bone infection that just hasn't cleared up with standard treatments.
Stubborn bone infections.
Very stubborn. HBOT can help by improving oxygen levels in the bone itself, which is normally hard to do, promoting healing. Often still needs surgery, debridement to remove dead bone, but HBOT can make a real difference.
Seems like getting oxygen to tricky places is the theme. What about after radiation therapy? Sometimes that causes problems, right?
Absolutely. So radiation injuries to tissue are another key indication. This includes osteoradionecrosis, bone damage from radiation, and soft tissue radionecrosis.
Why does radiation cause these issues?
Well, radiation, while killing cancer, can also damage the tiny blood vessels and healthy surrounding tissue. This leads to poor blood supply, poor oxygenation, and wounds that won't heal, sometimes years later.
And HBOT helps out.
It stimulates angiogenesis, the growth of new blood vessels into that damaged, poorly vascularized tissue, and it boosts oxygen delivery. We see good results, for example, with osteoradionecrosis of the jaw after head and neck cancer treatment.
That offers real hope for people dealing with those late effects. Okay, almost there. Any others?
Just a couple more key ones. Compromised skin grafts and flaps. When tissue is moved surgically, it needs oxygen to survive before its new blood supply grows in. HBOT provides that essential oxygen boost, increasing the chances the graft or flap will take.
Giving it a lifeline. Makes sense.
And finally, one that's very time-sensitive, acute central retinal artery occlusion, CRAO.
A what now?
Think of it as a stroke in the eye. The main artery to the retina gets blocked. Sudden vision loss. The retina needs oxygen constantly. HBOT, by dissolving extra oxygen in the plasma, might help keep some retinal tissue alive if started very quickly, ideally within 24 hours. It's a chance to preserve some vision.
Okay, that's quite a list. From dive accidents to chronic wounds to eye emergencies. It's clearly a versatile tool when used correctly.
It really is. It harnesses basic physics to create powerful physiological effects. It's moved way beyond being just a concept. It's solid, evidence-based medicine for these specific situations.
So wrapping this up then, we started with the physics: more pressure equals more dissolved oxygen. We saw how that extra oxygen fuels healing, fights certain infections, shrinks dangerous gas bubbles, helps tissues recover from CO poisoning, trauma, radiation damage, and supports grafts. A whole range of benefits.
Exactly. But again, and it's worth repeating, this is targeted therapy. It's for these specific accepted medical indications where the evidence is strong. It's definitely not a magic bullet for everything. Always needs proper medical evaluation and supervision.
Understood. Stick to the science. But it does make you wonder, oxygen is so fundamental, right, to everything.
Absolutely.
As we learn more about precisely how HBOT works at a molecular level, Could there be other applications discovered down the road? Again, not talking about the unproven stuff now, but just future possibilities based on solid research.
It's a fascinating thought. Hyperbaric medicine is still an evolving field. Research is ongoing, always refining our understanding. So who knows what rigorously tested applications might emerge in the future? It's certainly possible.
Well, this has been a truly illuminating deep dive. If you listening found this as compelling as we did, definitely check out the resources in the show notes. Look for reputable medical organizations focused on hyperbaric medicine.
Good advice.
It's a really interesting corner of science and medicine. Maybe it even sparked an interest for someone considering a career path. Thanks so much for